we're back with the Rocket Right Show. I'm Dr. ColeBlunt in the house with Hurricane Betsy Barnes. And our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center. And we're excited to have with us Dr. ColeBlunt, who is a hematologist oncologist at Mary Bird Perkins, Our Lady of the Lake Cancer Center. Thank you for joining us.
No, thank you, ladies, for having me. I'm really excited to be here with you all.
Well, we are so glad that you made time for us. And I know that you just recently joined the team at the Cancer Center. So tell us a little bit about your background and what led you there?
Absolutely. So I'm originally from Brenham, Texas, which is a small town in Texas where they make Bluebell ice cream. So that's our claim to fame.
Here,
so if you like ice cream, shout out to Brenham, Texas. I went to Baylor University for my undergrad, and then Texas A&M for med school. And a huge part of my choices in college and med school was the desire to stay close to my family. I have 3 younger brothers, and there's a little bit of an age gap between us, and so I really wanted to stay around so I could watch them grow up. And when I decided that I wanted to pursue a career in hematology oncology, I matched at LSU Shreveport. During my fellowship, I met my husband Raymond, and we have stayed in Louisiana. So I've been retained after I met Raymond, and we've been happy. And most recently, we've welcomed a baby girl to the world.
Congratulations.
Thank you. I have an 8-month-old daughter named Zuri, and my husband graduated from LSU in May, and he's going to be pursuing a law career at Southern in the fall. And so that was the big motivation to move, is we both had opportunities here, and so far so good.
And very nice when you have family around to help out with the baby.
Absolutely,
right?
yes.
And to enjoy growing up.
I come from a long line of Aggies on my dad's side, so gig 'em.
Gig 'em.
That's right. Don't hate me because I gig 'em. I'm just telling
what
you.
that means.
That's right. We're so glad to meet you.
Thank you.
So tell us, what sparked your interest, though, to go into medical oncology, hematology, and talk a little bit about, sometimes people don't realize that those two things a lot of times go hand in hand. They don't think of them together, but they are.
Yes, they are together. Several things kind of led me here. I had a personal experience with a really close family friend who was diagnosed with an advanced ovarian cancer and subsequently died from her disease. She was really close to my mom, and we were actively involved in kind of going to visit and just being a part of that journey in those last days of her life, and that kind of really stuck with me. When I was in medical school, I had the opportunity to shadow an oncologist in the Bryan-College Station area, and I don't even know if she knows how much of an impact she had on me, but her name is Dr. Erin Fleener, and she worked in a cancer center. I sat in a room with her while she met with a family of a new breast cancer, a patient who had been diagnosed with breast cancer, and it took a lot of time, patience, and care to answer all of the family's questions, make them feel comfortable, and kind of make that horrible diagnosis approachable for them.
Right.
And I kind of looked at that moment. I was like, that's what I want to do. And then I always believe in, God leading you in a certain direction. When I was in residency, I had a mentor. Her name is Dr. Sharonda Henderson. She's still at Baylor Scott and White in Temple, Texas. And she really solidified my desire to go into this field. She's a wonderful doctor, excellent practitioner, takes great care of her patients. And she really took the time to nurture me very early in my career. And so it was too many signs. I feel like it was destined to be. And I was just very blessed to be able to pursue this career. And I'm really, really happy.
That's great. And that's a lot of training.
Yes.
It's a lot of schooling.
It's a big commitment.
So you have to like it and have a mission to help those patients.
Yes, you do.
And your passion for it shines through. And you giving, honor to those that mentored you is so important. So we want to make sure that they hear that. Yes.
So important. And I know this job can be kind of tough and weigh on you mentally and emotionally. Right. So I want them to know they made a difference,
And that's great, because I think, everyone has someone that really impacts their life as to what they're going to do going forward. And it's great to hear those stories. Now that you're at the Cancer Center, talk talk about some of the advanced treatments that you're really looking forward to being able to offer to patients there.
Yes. So they've worked really hard at Mary Bird Perkins and the Lake Physician Group to provide the best up-to-date treatment for the patients there. Immunotherapy has really changed the landscape of how we approach and treat cancer. And so we are able to offer our patients the latest and the most up-to-date therapies that are out there. And a lot of people, immunotherapy kind of can sound very vague, but put simply, we use the body's immune system to kind of help identify, kill cancer cells that ultimately relate in patients doing better. And it provides treatment for patients who might not have been a candidate for traditional chemotherapies or what we would consider like standard therapy. Just a couple of weeks ago in my clinic, one of my colleagues used a herpes virus injection to treat a localized melanoma. So that's just one of the examples of how we can utilize these new technologies to help our patients.
And some of those are through clinical trials.
Yes. So we have a very active clinical trial program at Mary Bird Perkins. It works in conjunction with our multidisciplinary team. So you have clinical trial coordinators, surgeons, radiation doctors, pathologists. Like, we all come together, meet, discuss the patient's care, and come up with a treatment plan that we think is going to fit that patient, and making sure that they don't miss an opportunity to be a part of a clinical trial is a very important part of that process.
Right, because a lot of times they think they got to go off somewhere, but y'all offer so many amazing clinical trials right here, so that the patients are really getting the cutting edge, treatments that are out there.
I think that's really important because, we know that South Louisiana is family oriented, and that these patients thrive best when they get to stay in the environment where they're most comfortable. And so, no disrespect to those larger institutions, they are excellent, but we can help you here.
There's something about TLC and being able to see that family face on a regular basis to kind of make you want to get through those very difficult times. And talking about difficult times, people, don't really always think about just the treatments. You mentioned immunotherapy, chemotherapy, radiation, but a lot of time that really impacts their nutritional state, because it can impact how they can swallow, or their with the nausea and vomiting, being able to hold down enough, food. Talk about that program, because that's a big part of it over there.
So the nutritional program is a part of a larger program. We have wonderful navigators in the Cancer Center. And so anytime a patient comes to our center with a new diagnosis, or someone who's developed a new problem during their treatment of cancer, we rely heavily on our nurse navigators to come evaluate the patient and help plug them into those resources that we think would help them the best. Nutrition services is one of those. So these are trained nutritionalists that are able to tackle the challenges that patients can face when approaching how to eat a healthy diet, complications from their treatment, so that they can get through this experience with a positive kind of outlook and help maintain their health as much as we can.
Absolutely, because it's hard to respond well to treatment if you're malnourished, because you're not able to take in the right amount of calories or eat healthy. And so I know you told me you were up the road a little bit in Louisiana. So you came from Texas, and then you kind of hit North Louisiana, and then you kind of came on down a little bit, Lafayette area, and like, bam, here you are in Baton Rouge.
Yes.
So what do you like to do in your off time? Because, probably, between working and a new baby, I don't know if there is much off time, but what do you like to do here in Baton Rouge with your off time?
So I'm a huge family girl. Just a couple of weeks ago, my mom celebrated a birthday, and my family came down to visit along with some really close family friends, and we just kind of hung out and enjoyed each other's company. My husband and I like to take little trips on the weekend, but you're right. A new baby girl takes a lot of my time, so I enjoy being a mom.
That's wonderful. That's wonderful. And there's so many places to just go on the weekends around the area and see the state, because Betsy and I have talked about that a lot. So
There's a lot of good things to do, and Baton Rouge, I think, is a very family-oriented place, and I think that you're going to find a lot of people that want to be, close to you and your family, and so you'll have an extended family.
Yes.
You'll have the family that you had before, and then you'll have the rest of us who
My new
adopted
family.
you. That's right. That's
Well,
right.
We are so glad that you took time out of your busy schedule to come join us. We've been talking with Dr. ColeBlunt, who is a hematologist oncologist at Mary Bird Perkins, Our Lady of the Lake Cancer Center. And I'm sure if somebody wants to find you, they can just go to marybirdlake.org, right?
And you'll find my provider page as well as our contact information. And I'm here to help you in any way I can.
Thank you so much for being with us, Bets.
That's wonderful. Thank you. It's a pleasure to meet a new doctor with Mary Bird. We've gotten to meet so many, and everyone has been just so genuine and wonderful. So thank you for being here.
Thank you guys for having me.
Sure. And we're going to be right back. We're going to be talking with David Thaddeus Baker. You're going to want to meet this guy. He really has a lot going on in New Orleans. Everything from photojournalists, art shows that he's helping coordinate, to the New Orleans Press Club. He is a writer, an editor, and just a really motivational, inspiring person. And we're going to be right back with David in just a moment. Hang tight with us on Rocket Right with Hurricane Betsy Barnes and Dr. ColeBlunt.